Yeah, well, of course we're concerned. I mean, the infection rate is high. Comparatively, the hospitalization rates are still lower than we were last year. So we're concerned, and we're working on the factors that impact the hospital. That's why I visited there this morning at Rhode Island Hospital and met with staff there and walked through the emergency room. Right now, they have they're about 113% of capacity, but the capacity is about 65% of their normal capacity because of staffing. So we know staffing's an issue. We know that the testing, which I believe is a success story in the state of Rhode Island, being up to almost 25,000 tests in a day, which is 2 times what we were last year at this time. So we're still working on making sure that we keep the sites open up more sites, get more municipalities involved in the testing, and then the boosters are critical for us at this moment in time. And then a message I think that I would deliver to the unvaccinated: look, you've made your decision not to get vaccinated. I don't understand it, but I certainly will respect it. But you need to take special precautions right now. Unvaccinated people in the state of Rhode Island need to take special precautions. I was told today that anywhere from 50 to 75% of the COVID hospitalizations right now are unvaccinated. So we need to make sure that we get that message out to the unvaccinated. You made your decision, we respect it, but you need to take special care and be quarantining yourself to a degree right now during this spike in infections, because you are very, very vulnerable.
You mentioned the testing. There's a lot of demand right now. I know you said we're testing more than before, but there's a lot of demand. People can't get appointments for days. They can't find rapid tests. In Massachusetts and Connecticut, the governors went out on their own and procured rapid tests. Should Rhode Island have done more to get more rapid tests in the state faster?
Well, my understanding is that it's here very shortly. So we're working through the logistics on that. And as far as our testing goes, we have expanded it. If you go to Central Falls today, we've addressed the problem in about 48 hours. There was no lines there Saturday and Sunday morning. No lines there today in terms of outside, because we've got them all inside. So we're going to take each community at a time, and if there is a situation where it needs to be improved, we're going to improve it one community at a time. So we're going to continue to do that. And then as far as the schools go, we're very, very pleased the way the schools opened up. We have very good buy-in from all the parties, whether it's the NEA, the AFT, the school committees, the superintendents. RIDE, our office met multiple times last week. We'll be meeting before the week's out to making sure that we get our kids in, safely in school. And the testing is a big part of that.
I guess what I'm asking, you still haven't heard from the federal government as to when those million tests are coming.
I don't have a date, but I do know that we're in process, and we expect that they're going to be in timely. And we do have, we are distributing some home tests right throughout the state. I know that we got a couple thousand to Mayor Lawza yesterday when he asked for people that were in line in a non-state testing site. So we're going to continue to do the work. I think that you're going to see that bringing on Director Pappas on a full-time basis here is going to really kind of make sure that we do the work that needs to be done.
Has your team
plans in place for the National Guard? I know you mentioned that today.
Yeah, so National Guard is, we've been in discussion with the general, and we thank him and the Guard again for stepping up in a way that I'm not sure that they were really expecting, right? But they are, I think, was over 180 people that are going to be working on the vaccinations and the testing. We know that a number of them are in Central Falls today, coordinating some assistance. We are in discussions with the hospital in terms of what that could look like. But we also understand that, for instance, we had one hospital that had a couple security guards pulled from the National Guard and placed somewhere else, but they were security guards at one of the hospitals. So we want to make sure that it's not a zero-sum game here, that we're taking people that are coming from one healthcare setting and then pushing them into another, because that doesn't work. But we have talked to the hospitals about how professionals like the National Guard could play some level of a role in the hospital. So we expect that will be happening.
Just a couple of minutes. Can you describe what you saw at Rhode Island Hospital? How severe was it? What did you see?
Well, I think that the description that we've heard from the from the emergency physicians, as well as the head nurse that was walking us through, they were certainly describing a stressful issue. And as I said, it's stressful because of staffing, more than anything else at this point in time. And if they're at 65 to 70% operational, if they're 113% on the 65, then they're certainly not even, functioning at 100% of what they actually could do, if they were staffed. So what we saw was exactly what's being described, is there's stress and this pressure. They're very professional. They are dealing with it, and they're working their way through those issues. And we intend to be visiting emergency rooms around the state to make sure that, and talking to the different, hospital leadership around the state of Rhode Island, to get a sense on what it looks like in the other emergency rooms. And we are making, some efforts in terms of figuring out how we can open up urgent cares, to take some relief off those emergency rooms. And also we're looking to, and we made some progress this weekend talking to the insurers about how we can release patients on a more timely basis when they're ready to go home, to open up beds for people that they can serve. So we got multiple things that we're working on. I think when they put them all together, we're going to, show pretty good progress on those level and relieve as much stress as we can. That's stress.
Last one, we got to go.
Yep.
Has your team tried to go on the open market and procure rapid tests like it seems Massachusetts and Connecticut did? Even, it seems like in one case, usurping or maybe getting some tests that were destined for Rhode Island. But has your team tried to look for those options apart from waiting for the federal government?
I believe we have, and I expect that we're going to have some pretty good results on that very shortly.